Yeah, we are already been talking about the compound injuries all around the upper extremity and the lower extremity both. The standard protocol is already been there, like doing the good debrima, stabilization, sometimes using the vacuum suction drainage, local antibiotic application. Like this, we are helping the patient in terms of the control of the infection and getting a early good functional outcome at the end of the day. But one of the important thing, like the apart from the management of the bony structure, we have to manage the soft tissue, especially the coverage of the wound. The objective is to describe the benefits and hazards of the primary, to describe the principles of the vascular pedicle coverage, and to describe the significance of wound debridement. That is very, very important thing. Once you are going to debride the wound in a proper way, you are going to have the better outcome at the end of the day. The lavage of the wound is equally important by using the copious amount of the saline, depending on the size of the wound. Even one can go with the
Sudhir,
saline
slideshow and it is not moving.
it's not moving.
Go
Slides
to
are not moving,
slideshow.
हाँ fix है.
Abhi, can you see?
No, we can see, but go to slideshow and then start moving.
You already been sharing the screen.
Share हो रहा है, but if you can go on slideshow mode.
Yeah, just go to the bottom of the screen and you will see your slideshow.
Slide control is there on bottom of the screen.
Yeah, on the right side you will see.
Already been there. I can see it very well, but I don't know.
You can then, oh, okay, maybe go down on this only in your slides. The slides are not moving.
Now, either slides are moving.
No,
नहीं
not
move
yet.
हो रहा है sir.
Maybe you can again share it, stop
Share it
sharing,
again, yeah.
and then share
Exit,
it again.
exit, and then yeah. Now reshare, sir. Perfect. Yeah, there we are. Great.
Is to describe the benefits and hazards of the primary coverage, to describe the principles of the vascular pedicle coverage, and to describe the significance of the good wound debridement. The aims and objectives are the pre-operative planning to reduce the intra-operative hazards, to improve, and the principles are like replace the tissue like with the like. If needed, use the tissue bank. Functional and aesthetic aspects are equally important, and there must be a backup plan if the surgery is not going to work as a primary procedure. And the timing of the surgery is very, very important. Once we are going to talk about the regional flaps, is the characterized by a pedicle that remains in continuity with the tissue defect, while the transferred tissue originates from the same extremity, has got a longer arc of rotation than the local flaps. I will like to show a few of the examples, like the lateral supramalleolar flap. The blood supply depends primarily on dense arterial network originating from the fibular and the anterior tibial artery. Drainage is by the dense superficial venous network that accompanies the artery. One of the example is here, like a patient is having a crushed injury of the foot with a devascular over the dorsum of the foot. Can you see?
Yes.
Yeah. After once you are going to open the wound, reverse this skin flap on the distal side, you can see a good amount of the exposed bone, the tendons, fractures, and the devitalized soft tissue around it. So doing a debridement with the excision of the dead tissue is equally important. Like you are going to remove it from here till all around the distal part of the flap. Yeah. Any problem?
Go ahead, sir. Go ahead.
Yeah. So we did the debrima, and by using the lateral supramalleolar flap based on the distal part of the artery and perforators, did a coverage of the dorsum of the foot. This is the early result with the over the recipient area, the donor's visible donor side, the healed defect after the 4 weeks period. The primary stabilization with the KVAS is equally important for the bony structures. So this is one of the example. Another example where we have used the extensor digitorum brevis muscle flap is a dominant, particularly lateral tarsal artery that runs under a plane deep to the muscle. The lateral tarsal artery branches from the dorsalis pedis artery at or immediately distal to the extensor retinaculum. Veins and nerves follow the main arterial pedicle. A defect on the lateral side of the ankle joint with a fracture of the distal part of the fibula. The bone was exposed. Either one can think for a debridement over the area, and this exposed bone along with the joint do require the coverage. So we have harvested the extensor digitorum muscle brevis flap based on the lateral tarsal artery and rotated proximally to cover the area. This muscle flap has got a potential which can be dissected up to the mid leg, and even one can cover the anterior part of the fibula with the help of the extensor digitorum muscle brevis flap. So this is the intraoperative pictures. The early post-operative, that is the coverage with by primary partial thickness grafting over the muscle flap. This is the early results after the 72 hours. The late result for about 4 weeks period, and patient was having excellent healing over the lateral aspect of the ankle joint. Once you are going to cover the area with a muscle flap.
मजा आ गया एकदम एमएलए साहब देख के डाउन टू अर्थ इको ना द फैमिली उदा दी डाउन टू अर्थ ਤੁਹਾਡੇ ਵਰਗੇ ਸਾਰੇ ਇਨੇ ਹੈਲਪਫੁਲ ਦ ਡਾਊਨ ਟੂ ਅਰਥ
Sarvadeep,
ਹਾਂਜੀ
Mute yourself.
So you can get a good coverage over the area along with a good vascular supply through the muscle flap. One of the example I have taken it from the upper extremity, that is the posterior interosseous artery forearm flap, is the distal anastomosis with the vessels around the wrist joint with the anterior interosseous artery and dorsal carpal arch, passes deep to the supinator and crosses the distal border before coming in relationship with the posterior interosseous nerve. So this is one of the reliable way of coverage over the dorsal aspect of the hand, although the distal reach is limited. This flap is very reliable without sacrificing the major artery. A patient with a crush injury over the dorsum of the hand, a comminuted fracture of the multiple metacarpals, wound was contaminated. Patient came within 8 to 10 hours after the injury. We did a thorough debridement over the area, and the wound was converted from this condition to a condition on the right side, a much better after a debrima, and the washing with a copious amount of the saline. Did a coverage with a primary coverage by using the posterior interosseous artery forearm flap. There was a good healing over the donor area or over the recipient area, and there was a not significant defect over the donor area. So in this condition, the various factors which influences the primary coverage over the area, that is the general condition of the patient, local vascular status, mechanism and energy of the trauma, regional vascular perfusion in the area of the interest. If the infrastructures are not suitable, things may be difficult to get a reliable result in a compromised setup. Results are consistently reliable. Early resurfacing gives the superior functional outcome, and single stage procedure reduces the hospitalization and the period of the disability. One can plan for the secondary reconstructive procedure once you are going to cover the area very well over the by providing a suitable resurfacing over the defect, and same time you can reduce the possibility of the infection at the site. Complication may include overall like a marginal necrosis, complete loss of the flap, which is although very rare, but this may happen. Wherever you think this is the things are simple, but even getting a complete loss of flap is not unknown. There may be a persistence of the infection, but possibility of the infection is much lower if you are going to cover the area primarily. Don't let the infection settle down over the area. Either one can think for a primary coverage or one can think for a delayed primary coverage. There may be a recurrence of the deformity. That is one of the complications. The knowledge of the reconstruction gives the confidence of the good debridement. More you are going to debride, more you are going to do the proper debridement, the possibility of the infection is much lower side and functional outcome is much better. Wound to be explored and early reconstruction is the key of success. Thank you very much.